This solution is used to address a specific form of cancer known as chronic myeloid leukemia, CML. Its function is to impede or halt the proliferation of cancer cells. Before starting to use omacitaxine, make sure to read the medication guide and the instructions for use leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. This medication is given by injection under the skin as directed by your doctor, usually twice a day, every 12 hours, for 7 to 14 days. This cycle should be repeated every 28 days as directed by your doctor. The dosage is based on your medical condition, body size, lab tests, and response to treatment. Do not increase your dose or use this medication more often than prescribed. If you are using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional and the instructions for use leaflet. Also, make sure to learn how to store, transport, and discard the medication and medical supplies safely. Before using the medication, wash your hands, wear gloves and protective eyewear, and check the product visually for particles or discoloration. Also, make sure to clean the injection site with rubbing alcohol before injecting each dose. Change the injection site each time to lessen injury under the skin and do not inject the medication in areas of the skin that are bruised, hard, red, tender, or have scars or stretch marks. If the medication touches your skin, wash your skin right away and completely with soap and water. If the medication gets in your eyes, flush the eyes with water right away and call your doctor afterwards for further instructions. Side effects of omacitaxine solution, reconstituted, Recon-Soln, may include diarrhea, nausea, vomiting, constipation, abdominal pain, weakness, headache, difficulty sleeping, nosebleed, tiredness, loss of appetite, and pain at the injection site. Temporary hair loss may also occur, but normal hair growth should return after treatment has ended. Serious side effects may include swelling hands/ankles/feet, joint/back pain, decreased bone marrow function, anemia, decreased ability to fight infection, easy bruising/bleeding, and rare but serious bleeding in the brain or stomach/intestines. This medication may also cause a rise in blood sugar, a rash, and in rare cases, a severe allergic reaction. It's important to tell your doctor if you experience any of these side effects, as careful monitoring may decrease your risk. If you have diabetes, you should check your blood sugar regularly and share the results with your doctor. And if you notice any other effects not listed, make sure to contact your doctor or pharmacist. Before using omacitaxine, make sure to inform your doctor if you have any allergies or if you have a medical history of diabetes, bleeding problems, or current/recent infections. Omacitaxine may increase your risk of getting infections or worsen current infections, so it's important to avoid contact with anyone who has a contagious illness. Be sure to talk to your doctor if you have been exposed to an infection or for more details. Let your healthcare professional know that you are using omacitaxine before getting any immunizations/vaccinations, and avoid contact with people who have recently received live vaccines. To lower the risk of getting cut, bruised, or injured, be cautious with sharp objects and avoid activities like contact sports. This medication may cause drowsiness, and alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, be sure to talk to your doctor. Before undergoing surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this medication, especially experiencing easy bruising/bleeding, bleeding from the stomach or intestines, unusual tiredness, and signs of infection. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor. You should not become pregnant while using omacitaxine, as it may harm an unborn baby. Women using this medication should inquire about reliable forms of birth control during treatment and for 6 months after the last dose, while men should ask about reliable forms of birth control during treatment and for 3 months after the last dose. If pregnancy occurs, it's crucial to talk to your doctor right away about the risks and benefits of this medication. The effects of this drug on breast milk are unknown, and because of the potential risk to the infant, breastfeeding is not recommended while using this medication and for 2 weeks after the last dose. Be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with omacitaxine solution, reconstituted. This medication may interact with other drugs that can cause bleeding or bruising, such as antiplatelet drugs, NSAIDs, and blood thinners. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist to ensure the safety and effectiveness of your treatment. If you are taking low-dose aspirin for heart attack or stroke prevention, it's important to continue taking it unless your doctor advises otherwise, as it may increase the risk of bleeding when used with omacitaxine solution, reconstituted. Be sure to consult your doctor or pharmacist for more details on how to manage potential drug interactions and to ensure the best timing for taking this medication. If this medication is accidentally ingested, it can be harmful. In case of an overdose with serious symptoms such as passing out or difficulty breathing, it is important to seek immediate medical assistance by calling 911. Otherwise, contacting a poison control center is necessary. Residents in the U.S. can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It's important not to share omacitaxine solution, reconstituted, Recon-Soln, with others. While using this medication, it's important to have regular lab and/or medical tests, such as a complete blood count and blood glucose tests. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you happen to miss a dose of omacitaxine solution, just skip the missed dose and take the next one at your regular scheduled time. It's important not to take a double dose to make up for the missed one. When you receive your omacitaxine solution, reconstituted, Recon-Soln, it's important to store it properly. If you're keeping it in the refrigerator, make sure to use ice packs or a cooler when transporting it. If stored in the refrigerator, the medication expires 6 days from when it was first mixed by the healthcare professional. However, if kept at room temperature, it expires 12 hours from when it was first mixed. Remember to keep all medications away from children and pets, and never flush them down the toilet or pour them into a drain unless instructed to do so. When the medication expires or is no longer needed, make sure to properly discard it. You can find detailed instructions on proper disposal in the medication guide/instructions for use leaflet, or you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.